And welcome to the news at 10. An Idaho organization says a growing number of moms and babies are struggling to stay healthy.
It's a problem health advocates hope lawmakers address during the upcoming legislative session. Abby Davis read through the most recent report on the issue done by Idaho Kids Covered. And so, Abby, question is, what did you learn?
Well, not only does the report bring up the rising death rates of moms and babies, it also delves into other issues like why some families can't access critical health care. A recent Idaho Kids Covered report shows some pregnant women, new moms, and babies can't access the care they need to stay healthy.
It is really hard to get maternal health care in our state.
Health policy specialist Ivy Smith, who helped write the report, says that barrier to care is leading to more moms and babies dying.
Our report pulls data from several sources, including the Idaho Maternal Mortality Review Committee, the Idaho Department of Health and Welfare, and then some of our national healthcare partners.
The report shows Idaho's maternal mortality rate went up 121.5% over a 2-year period. Smith says state data shows there were 40 pregnancy-related deaths per 100,000 live births in 2021, compared to just 18 per 100,000 in 2019. The report also states the infant mortality rate went up 18% during that time period. State data shows about 5 deaths per 1,000 live births in 2021, compared to about 4 deaths per 1,000 2 years before.
It really is just so troubling to see how those rates are rising.
To keep moms and babies alive, family medicine physician Caitlin Gustafson says state insurance policies need to change.
Idaho has one of the lowest bars that we could have for enrollment in Medicaid. Medicaid is what keeps pregnant patients safe in this state,
especially patients in more rural areas. Gustafson says she'd like to see lawmakers expand postpartum Medicaid coverage from 60 days to 1 year.
To put us in line with the great majority of states in our nation, knowing that that's what improves care and keeps families safe to have that access to care.
Gustafson says inflation and Idaho's shortage of providers only compound the problem.
Clearly, we can do better, but it's all intertwined. This lack of access, the financial barriers, the provider shortages, these are all part of this problem that's leading to these devastating statistics.
Most of these deaths are preventable. If we don't act now, these concerning trends are only going to continue.
The legislative session starts January 8th. In addition to increasing Medicaid coverage, Smith and Gustafson want lawmakers to reinstate the Maternal Mortality Review Committee. Idaho is the only state without a review committee because of a July sunset clause embedded into legislation.
Yeah, we'll see if legislators decide to take that up.
I can only expect a little bit of a pushback when it comes to expanding Medicare, excuse me. Yep. All right, thanks, Abby.